before allowing our child to go visit others' homes. We ask about if our child have any allergies, are there pets in the home? We ask about pools on the property, TV screen time, and we also ask about alcohol storage. And so we have to normalize asking about guns also, even if it's an emotional aspect of it.
Welcome to Unloading, a podcast created to share community solutions for gun violence in America. Unloading was created by Gun Violence Solutions of the American Medical Women's Association. I'm Kat, a pre-medical student in Chicago and assistant director of the American Medical Women's Association.
And I'm Anorvi, a fourth-year medical student based in New York. And we're here to show you how individuals across America are responding to gun violence in their communities.
With us, we have two lovely advocates from Moms Demand Action. We have Dr. Kelsey Gastineau and Julvonnia McDowell. So Dr. Kelsey Gastineau is a Moms Demand Action volunteer and board-certified pediatrician based in Nashville, Tennessee. A public health researcher, Dr. Gastineau is also a physician advocate specializing in pediatric injury prevention. One of her focuses is on a safe firearm storage as a Be Smart program advocate, a framework designed to help parents and adults normalize conversations about gun safety and take responsible actions to prevent child gun deaths and injuries. Her research experience and interests include implementation of evidence-based, community-focused interventions and secondary database analysis to reduce firearm injuries in youth. Her recent publications on this topic include utilizing the Be Smart program along with quality improvement methodologies to improve firearm safety discussions in a resident-based clinic in South Carolina, evaluating the increase in pediatric firearm-related hospital encounters during the COVID-19 pandemic, and demonstrating the increased burden of pediatric mortality and widening racial inequities due to firearm violence. She's also a member of the Tennessee American Academy of Pediatrics. Our second speaker, Julvonnia McDowell, is a volunteer with the Georgia chapter of Moms Demand Action. Julvonnia's 14-year-old son, Jawan, was unintentionally shot and killed by another teen playing with an unsecured gun on April 7, 2016, while visiting family in Savannah, Georgia for spring break. Julvonnia joined Moms Demand Action shortly after Jawan's death. As a leader in the survivor community, she's a dedicated mentor and support system for survivors and encourages a robust foundation of strength. One of her focuses is on safe gun storage as a Be Smart program advocate, a framework designed to help parents and adults normalize conversations about gun safety and take responsible actions to prevent child gun deaths and injuries. Thank you for joining us today. So firstly, how did you two get involved in the gun safety space?
Oh, well, thank you all for having me as well. It's an honor for me to be here today. I always plan to teach my child about the world. And now I'm telling the world about my child and the importance of the work I do in the gun violence prevention movement. My son, Juwan, was an incredible child. I used to call him Bud because he was my rosebud. A rosebud signifies beauty and purity. He was generous, well-mannered, well-spoken, and good looking, and I'll often say he get those good looks from his mom, the epitome of love. A month before we celebrated Jawan's birthday, we blew out candles on his favorite chocolate chip bundt cake, which was his favorite flavor. We watched him blow out his candles and made wishes that unfortunately we won't see fulfilled on this side of heaven. He was truly something to celebrate. And even in his death, we celebrate his life. And on April the 7th, 2016, a month after we celebrated his birthday, Jawan was shot and killed by another teen playing with an unsecured firearm while visiting family in our hometown of Savannah, Georgia for spring break. I got involved shortly after that so that I can express to parents the importance of secure storage and the importance of asking other parents and other family members and friends about unsecured guns in their homes before you allow your child to go visit for any type of vacation, any type of play date, even if they're just riding in a car. just making sure that you have that necessary conversation. And that is how I got involved with the gun safety space.
Thank you for sharing your story. I'm so sorry for your loss. I'm so glad that you're here and advocating and helping other parents so they don't have to go through what you experienced. So thank you, Anya. Dr. Gastineau?
Thank you both for having me and for elevating such an important topic. And I'm always so honored to share space with Julvonnia. So thank you for inviting me on a session with her as well. I have the absolute privilege of practicing as a pediatrician, working in the hospital, and probably like many of the listeners to this session and podcast, I have been a witness to the devastating effects of this public health crisis all too often. When I decided to become a pediatrician, this is not something I thought I would care for on a regular basis. I was prepared to take care of asthma, diabetes, dehydration, other common pediatric diagnoses, but taking care of children with firearm injuries was not something that I thought would be on the resume of a pediatrician. Yet during every single one of my emergency department rotations as a pediatric resident, I took care of a child or teenager with a gunshot wound. Nearly every time I was in the PICU, there was a child with a gunshot wound. And it was those preventable tragedies that led me to do this work, to become a physician advocate working in the healthcare sector and in the community with Moms Demand, to conduct research in the firearm injury prevention space, to make sure that those children and those families and their stories, that I could help them both in the hospital, but also to make sure that these preventable tragedies were not occurring to other families.
That's amazing. That's amazing that both of you kind of took your experiences witnessing that and, became strong advocates. So speaking of advocacy, both of you are very heavily involved in the Be Smart program. Can you tell our listeners what the Be Smart framework is?
So Be Smart is an acronym. The S stands for securing all guns in your homes and vehicles. M is modeling responsible behavior around guns. A is asking about the presence of unsecured guns in other homes. R is recognizing the role of guns in suicide and telling your peers to be smart.
Firearms are the leading cause of death among children and teens in the United States. And as adults, we're responsible for keeping our children safe. Secure storage is a simple and effective and life-saving measure that all of us can take to prevent senseless gun violence before it happens. So the framework of the Be Smart program is an educational program that provides the tools necessary to raise awareness and encourage good decisions on gun storage. Everyone that cares about the safety of our children, our kids in schools, communities, can play a part in preventing gun violence by sharing this information.
Be Smart is near and dear to my heart, as it's really helped me have better conversations with families and helped trainees build their confidence around these conversations. But I really appreciate how Be Smart not only emphasizes the key tenets of secure storage, making sure that firearms are locked, unloaded, separate from ammunition, but also raises the importance of that ask, the A, asking about the presence of unsecured firearms in other people's homes, as well as the risk of firearm-related suicide for our older youth.
Thank you. So when you talk about this framework and education about it, Dr. Gastineau, do you educate your patients? Julvonnia, do you educate other parents? Or are there, formal events where you're doing this education?
Yes. So with parents, we always encourage them to have that conversation to make sure, there's a difference between safe and secure. A lot of people say safe, but it's secure storage, making sure that the ammunition is separate and is locked and unloaded, making sure that gun is inaccessible to children at all times. That's the most important part. Having that conversation daily The T in be smart is to tell others to be smart. And the A is ask, making sure you're asking other parents before you allow your child to go visit. Even if it's a family member, we can't be sure that everyone will follow the same guidelines that we do in our own homes, but making sure that we're having that necessary conversation. I know at times it's emotional to have, it's an emotional conversation, but it's a necessary conversation, especially for the safety and well-being of our children. And we want to encourage that every single day. We want our children to grow to be healthy and loving adults. And it's unfortunate because of accessible firearm that kids aren't making it to see those milestones of birthdays that they should. Especially for me, I won't get to see Jawan. I didn't get to see him graduate high school. And unfortunately, I won't get to see him get married and become a parent. And I won't get the opportunity for him to graduate college, things that he wanted to do. I won't get that opportunity. And so I encourage parents every day, make sure you have that necessary conversation with other adults about the unsecured firearms in their homes to make sure that they're actually secured at all times.
Exactly as Julvonnia is saying, the Be Smart program is great because it's helpful to normalize the conversation around gun safety for gun owners, but also for non-gun owners. And as she mentioned, firearms are the leading cause of death for kids, and it is on us as adults to make sure that we're keeping the environment safe for children. And that's an issue for all of us. And so it really helps us focus on how do we keep these environments safe, keeping those firearms locked, unloaded, separate from ammunition, and how to have those conversations, which can be emotional and can be really challenging, but helps us all have those conversations. And so, yes, we absolutely do have those conversations in the outpatient clinic, in the emergency department, in the inpatient setting. The American Academy of Pediatrics recommends that we have those conversations with all parents, not just gun owners, but any and all patients and their families.
So both of you mentioned that these types of conversations can be very emotional. So, Dr. Gastineau, from your view, why is it difficult to have these conversations with clinicians who are training? And Julvonnia, in your perspective, why is it difficult to have this conversation with parents about gun safety?
Yeah, so we have evidence that guidance by primary care providers and other pediatricians improves safe storage of firearms in the home, especially when combined with a safe storage device like a cable gun lock. We also know that pediatricians and other healthcare providers really believe in this message. They know it's important and they know they should be providing this safe storage counseling. But for a long time, they have reported that they're infrequently counseling on this very important topic, despite them believing that it's very important. The most commonly cited barriers to counseling are lack of time, because there are so many important anticipatory guidance topics to talk about as a pediatrician, thinking about vaccines, thinking about car seat safety, thinking about nutrition, so many important things. So really trying to figure out how to be efficient with their time, feeling uncomfortable with the topic and with the language of safe storage counseling, low self-efficacy, and a lack of training. This is just not something that we're trained in as medical students, as pediatric residents, emergency departments residents, as fellows. But luckily, in the past few years, a lot of people around the country are doing some really great work on this. This is becoming more of an emphasis at the undergraduate and graduate medical education level. And the American Academy of Pediatrics, the AAP, now has trainings specifically for this. So there's a training called SAFER, Safe Storage Prevents Harm, that is for universal counseling that really targets these specific barriers that pediatricians have been citing for decades. There's also something called CALM, Counseling Against Lethal Means, from the AAP, that's more focused on lethal means counseling in those children that are in crisis with their mental health.
Yeah, so I think it can be emotional for parents as an issue because of, like Kelsey said, it's the verbiage. Sometimes it's the language that we use. We don't want anyone to feel that we're asking to be off-putting, but we're asking for safety measures. Just making sure that, there are many parents, many people are parents. Some are gun owners and some are not, may not be. But we've had several that have had experience with guns and some may not. And we don't want anyone to have that experience at all. And so by having this necessary conversation to make sure that guns are secure, there are other things that we as parents, we ask about before allowing our child to go visit others' homes. We ask about if our child have any allergies, are there pets in the home? We ask about pools on the property, TV screen time, and we also ask about alcohol storage. And so we have to normalize asking about guns also, even if it's an emotional aspect of it. You can use it via a text. You can send a text. Hey, my child is coming over. They're very curious. The pediatrician would like for me to ask, are there any guns in the home and how are they securely stored? Just before you allow your child for any play dates and things of that nature, just normalizing that conversation is very important.
Yeah, I love that, normalizing it. Just like you're asking about allergies. If your kid has allergies to certain foods, will there be gluten? Will there be this? Will there be oranges, whatever they're allergic to? I like that.
Yeah, I feel like the more you talk about it, the more, we integrate it into normal society. So kind of going off of that, Dr. Gastineau, I know in February 2021, you published your quality improvement study. So it's entitled Improving the Frequency and Documentation of Gun Safety Counseling in a Resident Primary Care Clinic. Can you tell our audience a little more about the project and what the study ended up determining?
Absolutely. So during my pediatric residency, the school shooting at Marjorie Stoneman Douglas High School in Parkland, Florida happened. And this tragedy really hit home for a lot of my colleagues and myself for various reasons, and really pushed us to get off the sidelines and start asking ourselves what we could do for our patients and our community. We started asking ourselves, is firearm injury something that's really happening in our community? Are our children facing this? And what are we doing about it as pediatricians, people that should care for children and everything about them? What are we doing? Like many research studies, we started to ask the questions about what we were seeing in our clinic and what we were doing in our clinic. And so, like we talked about, studies show rates of counseling are low, and that was the same for our resident run clinic. And so that prompted us to start a QI project, a quality improvement project, with the goal to increase how often we were having these discussions by improving our own confidence. And so then we partnered with the Be Smart campaign and provided education on how to have these conversations to our trainees, as well as having educational materials and gun locks available to our families in clinic. And so through these efforts, along with some tweaks to our electronic health record, we were able to increase the documentation of safe storage discussions from 3% to a sustained rate of over 80%, which was wonderful to see. And then they have now actually expanded this project into the newborn area, into the emergency department, and to the general inpatient settings, and are finding some great success using the Be Smart program in those clinical areas as well.
That's very cool. I actually read your paper, and it was really informative, and I really liked how you structured it. Do you think incorporating that counseling kind of like in the EMR was more beneficial than just telling the residents to ask about it on their own? Like, do you think offer them a certain level of accountability?
Yeah. People can't see my face right now, but I'm starting to blush when she gives me compliments. Yeah, so thank you. Yeah, absolutely. So I think we know in quality improvement work that education matters, but what education does is it lays that framework. And so I think multiple aspects of that project were really important. So we helped them learn about how to have those conversations and gave them the language. We know that pediatricians and residents are really worried about what language to use. We don't learn a lot about firearms and firearm safe storage devices. So it was really helpful for them to learn some of that language and then have that additional layer of the electronic health record prompt, so that when they were walking through every single one of those anticipatory guidance topics, like vaccines, like pool safety, and all of those really important things, they would say, oh, right, I need to talk about gun safety. And now I feel comfortable and confident in how to have those conversations, which is why I think we saw such great success. And we saw it spill over. So we saw this fantastic spillover effect throughout the medical organization. So it wasn't just in the outpatient clinic, but we saw nurses in our PICU start to have these conversations and ask us about it. We had, ribbons and buttons that we were getting asked for in different parts of the hospital because people realized, wow, this is happening in my community and I want to be a part of the solution.
That's awesome. I wish we had that training in medical school. And I know now it's becoming more and more present, but I think there's still a lot of work to do. So I really appreciate the project that you did and the aftermath of it. Both of you live and work in the South, and I know there is a lot of pro-gun culture in the states that you live in, the communities that you live in. How do you navigate gun safety advocacy in communities with pro-gun culture, and how have your communities been responding to your advocacy work?
I think that, when we think about the advocacy within the community of pro-gun culture, we're all more alike than we are different. Our top priority is and should always be the safety and well-being of our children and children in our communities. And it starts with the steps that we all take as adults. Speaking from a lived experience, I know firsthand that when guns aren't properly stored, tragedy can strike, whether it's a child discovering a firearm and injuring or killing themselves or someone else, or someone stealing an unsecured firearm or weapon from a vehicle use it to commit crimes. These instances of violence, deaths, and injuries are completely preventable. And I think going from that stance and speaking from that lived experience and knowing that we are more alike than we are different, you get more people being receptive to what you're saying and expressing that it's the steps that we all can take within our community to ensure the safety and well-being of our children at all times.
I love that response, and I want to upvote that response from Julvonnia because I think it's so good. I will just add that I think it is true that we need to understand that we do live in a country with a high rate of firearm ownership. In fact, we're the only country with more civilian-owned firearms than people. But it is also true that the majority of gun owners want to be responsible and want all children to be safe and protected. And so that is why I think we can kind of go back to what Julvonnia was saying. We are much more alike than different because many people think secure storage is very important. In fact, here in Tennessee, we just recently did a statewide poll and found that 1 in 2 parents are firearm owners, with the overwhelming majority of those thinking that firearms should be securely stored. And so gun owners and non-gun owners can all play a role in keeping kids safe from harm when we think about it from a secure storage standpoint.
Very well said. I like that. I think it's important to remember that just because people own guns doesn't mean that, there's malintent. I think everyone cares about the safety of our children and the safety of those in their community. So I appreciate those responses.
So earlier, I mentioned that there is an increase in pediatric firearm-related hospital counters that increased during the pandemic. So I was just wondering, Dr. Gastineau, what do you think caused the increase in firearm-related injuries in children during the pandemic?
So we've seen a few really good studies come out of this question, examining this. And I was lucky to lead one of the first studies asking this question in the beginning of the pandemic. And so we used one of the administrative databases called PHIS, Pediatric Health Information System, comparing that early pandemic, those first 6 months of the pandemic to the 3 years prior. And what we saw was what you were saying. Overall, hospital encounters actually went down, but we saw firearm-related hospital encounters go up significantly by about 40%. And I think a few things contributed to that. So first, there was an unparalleled number of firearm sales during that time. Second, children were atypically home from school, and that combination is uniquely risky. With children living in homes with firearms, specifically unsecured firearms, the risk of firearm injury of all types increases. And so that's what we were seeing. And third, the pandemic conditions not only heightened social and economic distress, but it exacerbated many of the structural inequities that contribute to firearm injuries. And so I think the takeaway message is that children come into the hospital for so many reasons. You all probably have seen this. Many of the listeners have probably seen kids come to the hospital for lots of different things, especially right now. We have the COVID pandemic that we've been seeing for these few years, the flu that we've been seeing, flu season, mental health struggles that we've been seeing with kids, children and teens, and the firearm epidemic. And sometimes trips to the hospital are just totally unavoidable. The difference with gun violence is that it's preventable through common sense, evidence-based policies.
That was a great analysis. I appreciate you guys coming in and sharing your time with us. You do incredible work. Is there anything that you would like the listeners to know or to think about to spark action in listeners?
Yes, of course. So I would like to say that as a parent, I honor Jawan by using my voice to talk to Americans all over the country from all walks of life about secure storage of firearms. For me, taking action isn't a choice. It's my new path and my new mission. But gun violence is an issue that we all need to worry about. I never would have guessed this would be my journey that I was supposed to take. And it isn't an easy one. Every day I struggle. I'm riddled with grief to this day. It'll be 7 years on April the 7th of 2023. But I have faith that my words are saving lives and that all of us want to protect our loved ones and community from pain. If my advocacy can save one life or prevent one family from feeling the same grief and trauma that I feel every day, then this work will be worth it for me every single day that I get up and I tell others to be smart.
So throughout the US, we know millions of children and teens live in homes with unsecured firearms, and that many of those kids know where the firearm is in the home, even if the parents think that that is not true. And the evidence is clear that when firearms are stored securely, locked, unloaded, separate from ammunition, all forms of firearm injuries, whether that's mass shootings, homicide and assaults, as well as suicide, self-harm, and unintentional shootings by children, can be prevented. In thinking of advocacy, one of the most important lessons a mentor of mine, Dr. Annie Andrews, has taught me is the power of showing up. When you take care of even one child with a preventable gunshot wound, you are motivated to show up. And unfortunately, when you look at the rankings of gun deaths and injuries, either overall, homicide, suicide, unintentional, the South is usually at the top. And that is not where you want to be. And so it can be challenging at times, but then I remember all of the children I have cared for, their families, and the communities that have been impacted by these preventable tragedies. And I am absolutely motivated to continue the work.
Thank you both so much. I personally didn't even know about the Be Smart program before I met you both, so it was really informative. And Kat and I have been doing this for a little while, so I think I'm glad that we have this podcast to broaden the reach because it is really important, and I really appreciate the work that both of you are doing in your communities.
Well, we are extremely grateful to you both for, like you said, broadening the message. There are Moms Demand volunteers in every state with Be Smart campaigns and people ready to go anywhere, including the medical facilities, schools. So now 8.5 million kids in the US are going home with the Be Smart message to help their parents securely store firearms. It's a very nimble message and can go in some different places: schools, healthcare, public transportation, anything you can think of. It's just a really great message. So we're excited to share it.
It's awesome. Thank you so much. Thank you both for taking the time out of your busy days to be here with us.
Well, thank you so much to you both. Julvonnia, always love spending time with you. That was a terrible heart on my end. Let me try again.
To learn more about the Be Smart framework and ways to promote responsible gun ownership in your community, you can visit besmartforkids.org. Thank you for listening.